왜? Sorry guys, we'll start soon. It's for the student who didn't come.
Do you need help?
No, it's okay. Yeah. Thank you. 기차가 뭐가 문제야? 연결선이 문제야? 무슨 로그인? 무슨 로그인? Nice.
سمعت ان السكسس ريت بتاعها استجد ان السكسس ريت بينجحوا اكتر من الجامعات التانية. كده سمعت في اول سنة.
يوم
All right, good afternoon, guys. I'm very sorry for the lateness. We will start the USMLE session right away. My name is CY. I'm the current president of the ISUS. It's such an honor to invite you guys to this session. I have been preparing for the USMLE for 3 months for now. And before I started my preparation for the USMLE, I actually had a personal session with Ki-chan over here. His name is Mr. Yu or Mr. Ki-chan. And it was so useful for me because the current the exam system in Hungary is based on the oral exam. So basically, in order to prepare the oral exam, you have to start from the scratch. But preparing this written exam-based examination, including the entire license exam, not only the USMLE, but also the ACM, right? And ACM, the UKMLA, and the KMLE, the concept of the method applies the same. So even if you're not interested in the USMLE, but also like other kind of examinations, this prep course will help you to prepare most time efficiently. And here I would like to introduce Mr. Yu. Come up front, and he will do the session. First, he will start from how to register the USMLE and then how to prepare. Thank you very much.
Hi, it's a pleasure to stand before you and give you this session. I want to give a little shout out to the president for allowing me to hold this session in such a magnitude. Actually, I know that we have a limited time and limited attention, so you know how there are practically millions of resources that we can refer to, but only a few that actually addresses how to study in particular. So I took the liberty of skipping the first part of registering because it's practically all in the web. So I think I would dedicate more time in explaining how the step one is going to be. That is to say, why should one apply for step one? You know, USMLE step one, step two, and then it used to be CK, which is the practical session, which has been shifted to English proficiency test. But in particular, why should someone do step one? This is because it used to be a very challenging and demanding type of study in the past, that is. So only the honored, the very studious were able to tackle this and think about going to the US. And the reason is clear that before it was pass-fail, it used to be, to 70 to 80. It used to be something that needs a lot of attention to get the high scores, and this was especially relevant for the IMG's international medical graduates if they wanted good seats in their residency match, they need a high score. But now it's only pass-fail. So if you get above 60%, that is, the scores don't matter. And I think they say that they're not even told, so don't even know which score you are. So in this manner, it has become something notoriously difficult to a prevalent, something that anyone can try without critical consequence or, I would say, extreme demanding study. So I hope that everyone, not only those who are interested in going to US, but also for those who are considering it for merely their 4-year study can actually have a good chance applying for this exam. So even for your study, this is good. So what really happens is that pertaining to our curricular study, 4th year second semester is the optimal period for applying this exam because, well, all these subjects are covered, and the exam preparation itself, I've told you that it's not as demanding, but it certainly takes time and effort, and this is where the 4th year second semester, this is where the least amount of curricular studies are demanded of us. So if you spend the whole semester, whole fourth year, second semester, and 1 month from summer break, it becomes the adequate period that you can apply for the exam and hopefully pass. So what about the others, right? So up to 4th year first semester, the priority lies in more of your curricular studies. That is to say, actually, I think you can apply, but there's not much point in doing it at this period. Your curricular studies comes first, and then comes the step 1. Even if you are aiming for the states, it's only after your subjects are covered and the curricular studies are on the way, you can have a good chance of preparing the exam. So, up to this point, I've told you that 4th year, second semester is the best period for preparing for the exam. After that comes our curricular studies. So it's actually goes by one's own situation. So if they're really going for the US, then you have to apply even if it's not 4th year, second semester. So I'm mentioning this because many people are more likely in their first, second, or third year, and they're asking, what should I do for step 1? What should I do for USMLE? And my answer is kind of straightforward, that you should really focus on your curricular studies. But this session will be helpful to those people also, because it kind of gives a reason for focusing on their curricular studies. So I hope everyone can take something from this session, regardless of their curricular years. There's actually a caveat to this, is that you must have heard a lot of people try for their step 1 exam preparation and kind of either fail or not be able to complete their session. And the reason is clear. They made trial and error. So I mentioned that this exam is now something prevalent, but if someone happens to have a lot of trial and error, then it kind of becomes a very challenging, very heavy study for them, and that's why a lot of the time, people cannot complete what I mentioned as prevalent. So I think if I can put it to one sentence, it's going to be: don't bite off more than one chew. And I will be elaborating upon this notion and hopefully present to you how we can minimize this trial and error. All right, so concept number 1 is that there is a clear distinction between 2 types of studies in our medical study, and I put it as the aptitude of our study. First is the academic type of study, and the second is the exam-oriented. So you must be familiar by now that exams are quite different from the general study. That is to say, if you want to go for an exam, there is a specific set of required abilities that the examiner requests from us, and if we study something other than that, you do not get the expected grade or result that you hope for. So the academic study kind of means the unlimited time resource. You go to a cafe and then carry around this large book of Gray's Anatomy, and you can read it for days on end, but that rarely helps you prepare for exams. It helps you in your general studies, but it does not help you in your exam preparation, right? So exam-oriented study kind of means that there is a limited time resource, and by time I also mean attention. So it's not merely about days, how many days, but also how much attention you can put into. So the academic study, more the better. You study everything, you read everything, and this kind of leads to this quality of being very exhaustive. And you can see by now that this is not desired in an exam-oriented study. So if one wants to pass the exam, they must have a sustainable way of approaching their studies. And this is what I want to demonstrate today. And this is something one should not do. One should not do if they want to pass the exam. So if someone is intent on doing their exam-oriented study, what's the attitude? What's the concept they should always hold? Is that what is least required to get something correct? And this is actually going to be the maxim of all that's going on around here. So you do not want to start your exam studies by saying that, I'm going to study everything that's relevant about a specific problem, of a specific exam question. No, it's actually the very opposite. You have to have an exam-oriented mind. You want to pass the exam. You want to be sustainable, and that's why you always keep on asking, what is least required to get this question correct? Okay? And I'll be demonstrating it soon. And also, the second concept that I want to impress upon you before I start my demonstration is that there is a well-established course of study. So we are tempted to think that we start our first round of study, your second round of study, third and fourth, and so on. And the grades will get higher and higher as we study on, but this is really false. This is very false, a misconception that is held by so many people. And I think this is why a lot of people kind of give up on their first round, is that their first round of study takes so long that they fear that their second, third, and fourth are not going to make it before the exam date. No, this is not true. And what is really true is that their first round takes extreme amount of dedication, and then as one goes to their second, third, and fourth, it shortens exponentially, and kind of the grades follow along as well. So in their first round, the grade doesn't improve as much much or at all. And then only after the second and third and fourth round of their study can you see the grades go up. And the reason for this is actually quite obvious, is that let's suppose you need qualities 1, 2, 3, 4, and 5 to get a specific question correct, right? So if you're on your first round, you're only getting the first, second, maybe third qualities studied, right? But you still lack the fourth and fifth quality to get the questions correct. So in your first round, you're not going to see a rise in your grades, in your accomplishments. So if someone is cognizant of this fact, then I think I will be very confident in saying that they should not be so exhaustive in their first round. So this kind of connects to the concept 1, right? They should not be too exhausted in their first round of study. Okay, so this is where all the trial and error happens, and this is where most people who do not manage to complete their step 1 studies, this is actually where all people leave. They think that the study of step 1 is out of their reach when it's actually within their reach, but they're making it harder for themselves by being too exhausted. All right. So I've told you about trial and error, right? The first labs, second labs, third labs, fourth labs actually have different orientations. So in their first labs, all they can do is almost get to familiarize the concept, and that's almost it. So there's not much chance of getting the questions right. There's not much chance of doing much else rather than just familiarize. So do not go biting off more than you can chew. Only thing you can do at this point is just familiarize. And this takes a lot of time and effort, and you cannot be too exhausted in this. In the second round of their study, they kind of reinforce what they familiarize. And then at the third class, you get to solve the questions. And that's why you see a rise in the score. Okay? And beyond that, you get to solve similar questions based off the study so far. And this is how it goes. Objectively speaking, there is a very good sequence of study established. What goes wrong is that in their first class, in their first round of study, they wish to do everything. So they wish to familiarize, reinforce, and solve questions, and solve other questions, all at the same time. This is the trial and error I'm talking about. Okay, so I think I've pretty much conceptualized what I want to do here. So the main question now is that how can I be not too exhausted, right? How do I approach with this exam-oriented thinking? And we'll be doing some demonstrations regarding the questions themselves. So I hope that we'll be able to solve a lot of questions and convey to you the concept that I mentioned. So, yeah.
So guys, just to give you a quick catch-up, he had passed his USMLE exam during his fourth year, the second semester. So it's very reliable. And what it teaches you, the method of teaching is basically, so let's say the oral exam, when you start oral part, you start from here. And you basically have to memorize everything, the entire thing. But his method over here, the USMLE, and other exam course, he will center here, because this is where the question comes from, right? So you shouldn't start from here. Starting from here is basically like reading textbook, like from first page. Reading from the first page. You will be exhausted. That's what he was saying, the exhaustion. So what you want to focus is the centrifugated questions, because this is the most questions that you will get from, and this is called high yield. And this is why you have to start from, not from the first day, not from the board beyond, but only from U work, because the U work is the full of question bank and with the explanations, and he will teach you that. And if you want to get a high score, he will also teach you that. But this can be branched out by studying the options, because the questions for the USMLE comes with the multiple choice questions, right? And the correct answers is the centrifugated questions. But if you want to expand your question, the knowledge, you can study why the other incorrect answers is incorrect. That's how you branch out the information and studies. If you start from here, like the oral exams, like in Hungary, you will be exhausted and you will basically give up in the study of the USMLE. And he will teach you this concept of studying, how to approach this. I hope this makes sense.
Thank you. So, President kindly elaborated on this concept. So, always keep in mind what is least required of us to get this correct, especially if they are on their first round, second round of study. And I'll be demonstrating these specific methodologies. So, the first idea is that we should go directly to the questions. This is very foreign to a lot of you. I think I've heard this session. I think I've heard this video session. I think I've heard this Kaplan lecture slides. Something more than beyond Kaplan, so on, sketchy. It is very good. I'm not saying that's bad, but I'm saying that if one wants to do the exam-oriented study, they should go right to the questions. So, when should the teaching sessions stop before and beyond, sketchy and so on and so on? When should they be addressed? What do you think? When is the time to look at those videos and lecture slides and lecture notes and so on? So, any time before your second semester dedication period. Okay? So when you're studying when you're studying generally, they are good resources, but one should kind of narrow it down to the question banks. That's what I'm saying. Okay, so suppose that I finished my pharmacology subject, and I'm all good to start the USMLE Step 1 exam preparation. I come to face this page. What this is actually a Step 1 question bank. So I launch it. There's going to be this tab where you test, and you see the scheme. Okay, so you see that there are a lot of subjects, right? You start from biochem, genetics, blah blah blah, and then allergy, all the way to pathology. What do you do? What do you want to do? You're instructed to study the questions themselves. A real important concept is that you must reinforce what you study off of, and please do not go to random. Okay? This is a instructed on these questions, okay, please go by their specific concept. Okay, so in allergy and immunology, you have blah, 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 and then, for example, in cardiology, you have these key concepts, right? So we'll be looking at one of them. Is there any specific subject that one would like to simplify the session? Well, I think I might go with all. Okay. 19 questions, right? 19 questions. And you have this set of questions. What do you do next? You're instructed to study off the questions, right? Okay, what would you want to do next? And the good answer is that you go straight to the solutions. This is a second concept that a lot of people have not familiarized. And this is very important because it is in the explanations that we may able to study concepts. So please do not focus too much on the questions on your first class. So allow us to dissect this session, problem. So what's going to happen is that this person was found dead. Alright. And then the question shows that what's the likely cause of death, right? Likely cause of death. And there's going to be this much that's going to be given to us. And you actually go right to the educational objective. So anaphylaxis can quickly lead to respiratory compromise. Alright, so this is an anaphylaxis type 1 hypersensitivity, right? And distributive shock. Oh, so what is saying that there are two components to the anaphylaxis: respiratory compromise and distributive shock. And you can kind of deduce that these two are going to be what's going to cause the death, right? What's going to cause the death of this patient. Alright, so this much we've studied based on the solutions given. And in the autopsy, they're going to give edema, hyperinflation, and it's the upper airway edema to be exact, and cerebral edema. So right off the bat, we know that anaphylaxis causes respiratory compromise and distributive shock. Based on this, the autopsy should show upper airway edema, hyperinflation, and cerebral edema. And we now go to the question, which we have to address now, is this part, right? The autopsy shows diffuse cerebral edema, laryngeal edema, airway, and hyperinflated ones. So we've actually just dissected this question right up front. So you're asking, so this is good and all. What's the point of this? I think I feel a bit uneasy, right? Many of you know anaphylaxis, right? You know anaphylaxis. It's not maybe first year, but it's a prevalent concept, right? Now, after having established all these information, then we actually go to the explanation itself. So this patient with diffuse or blah 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 blah, that we already addressed. Most likely died from anaphylaxis. Anaphylaxis is a type 1 hypersensitivity, IgE mediated regulations. So this is too much. And this is why I was telling you that please do not focus too much on the explanations. Do not try to get everything into your mind on your first labs. In first labs, the only thing that was requested of us is that when somebody has a diffuse cerebral edema, laryngeal edema, and hyperinflated lung, they should be able to think of anaphylaxis. This should be established in their first draft. And this is the least expected of us. Why it is? It's actually not that important at this point. And this should be reinforced later on. So why do you think they have cerebral edema? Why do you think that they have cerebral edema? Due to cerebral hypoxia. So cerebral hypoxia. So why does hypoxia cause cerebral edema? So we can go on and on and on, right? This is not requested at their first round, okay? What is requested is that if somebody has diffuse cerebral edema, along with these respiratory compromise, then they should be able to think of anaphylaxis, okay? Why do anaphylactic patients develop laryngeal edema and hyperinflated lungs? Why do they develop laryngeal edema? So it says that it involves type 1 hypersensitivity, and then it has IgE mediated mast cell and basal cell degranulation, so kind of degranulation and inflammatory mediators. This actually causes the inflammatory mediators, and this actually causes the airway obstruction and restrictive shock. And in this airway obstruction, you have the spasms and edema. So this was actually addressed. The reason why anaphylaxis causes edema and hyperinflation was addressed very later on. Can you see this sequence? How I approached this case? I did not start with the question. I started with the solution, and I started with the educational objective that if somebody has anaphylaxis, they're likely to show respiratory compromise, distributive shock, and respiratory compromise takes shape of upper airway edema and hyperinflation. After all that, I stepped forward, and then why they have the laryngeal edema and hyperinflated lung is because IgE mediation, degranulation, inflammatory mediators, and so on. The stepwise approach, this is the sustainable way to go. So you should be very familiar with this kind of step-by-step approach. So after all that, you go to second last, third last, and then you're quite familiar with the concept. And this is where you tackle the other parts of the question. So a lot of people have chosen chronic obstructive pulmonary disease exacerbation. Okay, so a lot of people have chosen this. Why? Okay. Why? And that's the focus only after this first and second lapse of familiarizing and reinforcing the concept can you see that if somebody has COPD, they have hyperinflation, all right? And they can also have cerebral edema due to hypoxia, but COPD is actually a lower airway disease, and what should not be expected is an upper airway phenomenon. Do you see the sequence? How I went for this choice C. Only after that I've established the minimal concepts required of us in this example. And it is in this stage, it is in this phase that you can actually put the questions right. So please do not feel too pressured to get the questions right. Getting the questions right, as it will come later on. All right, so I think I want to impress upon this point. There's an additional question, additional information that is given to us. Okay, so to help confirm the diagnosis, patient certainty that's set for tryptase level analysis. So tryptase is a mediator released from mast cells, elevated in cases of anaphylaxis. I asked you, was this requested upon this problem? No, right? So that's why I've selectively chosen not to address this information until almost everything has been analyzed and settled. Now we can, at the fourth round maybe, or somewhere along the line, after having established all the information, can we take a look at this tryptase? It's also a mediator, and this can help confirm the diagnosis. Okay? Is this okay? Is this okay? If somebody tries to address this part right off the bat, right off from their first round, they become exhausted. And what puts more pressure is that you stop here, and then you go to the lecture slides and so on, and so videos and whatnot. So that's why I keep on saying sustainable means least amount of required information that is requested of us. Okay. Whoa. Let's go to another example. Oh, this anaphylaxis, right? Something we've just addressed. Can somebody reconstitute what they've studied on the first example? So it was somebody found it, and he had 1, 2, 3, right? Which pointed to anaphylaxis. And 1 was cerebral edema, and 2 was laryngeal edema, and 3 was hyperinflation. Cerebral edema was due to hypoxia, and the laryngeal edema and hyperinflation was due to upper airway obstruction. I don't think it's the upper airway comes really later on, so airway obstruction, and this was because of the degranulations in the inflammatory mediators, right? With this, we kind of go into the second example. Okay, so this woman was brought into the emergency department 40 minutes after being stung by little wasps. Okay. Following is most likely the cause of this patient's hypotension. We've dissected so far we do? Go right to the solution. In anaphylaxis, allergen exposure triggered widespread IgE-mediated inflammatory chemical mediators. Inflammatory chemical mediators by IgE mediation. This should be very familiar, right? This should be very familiar. This sentence itself should kind of connect to what we have dissected from this example. And then these chemical mediators cause peripheral vasodilation and vascular permeability and leading to hypertension. Cool. So this much was kind of requested of us in this problem, in this item. So we see that got stung by wasps, cause of hypertension. Most likely, there should be something along the line of chemical mediators and vascular permeability. This much is clear. And then we actually need to seal this concept by, okay, so what's in between, right? What's in between? Then we go to this part. Then we go to this part. So this patient has stroke, tightness, dizziness, urticaria, anaphylaxis, type 1 allergen. Selectively reading. So in patients who will eventually develop initial exposures, this was not part of what was requested of us. So what is requested of us, right? What is requested of us? Anaphylactic shock, vasodilation. So you kind of see now that this much was additional information. So here it's not asking how the anaphylaxis, how one developed the anaphylaxis. This is the part about the hypertension, right? So this should be focused upon. Right, so arterial vasodilation caused blah, 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 and then in addition to immediate so there's the concept of vasodilation and permeability. And this means hypertension. Is this okay? So I'm really selectively reading, and the reason is clear that if I read everything off the bat, it's going to put pressure on us. So, got stung by wasp. There should be something about the wasp and the anaphylaxis. That's true, but I think many people know that if you get stung by a wasp, you go into anaphylaxis, right? Is it too far-fetched? What do you think? If somebody gets stung by a wasp, they can develop anaphylaxis. Is this too far-fetched? What do you think? No, right? I think even the ordinary people know that if you get stung by a wasp, you go into this allergy anaphylaxis spectrum. But what ordinary people do not know that why it causes hypertension, right? So chemical mediator, vascular permeability, vascular dilation, vascular permeability, and hypertension. So this itself constitutes one concept that should be very familiar in the previous set, because in the educational objective, anaphylaxis had two parts contributing, which was the respiratory compromise and distributed shock. Also, the shock that happens in anaphylaxis is a distributive type. If somebody can make this connection, can hold on to this connection, I think this is a very, very good step towards minimally studying and so on. And then we go on the histologic aspect, so now comes the pharmacological part. And we go straight to the educational objective. Go straight to the educational objective. So anaphylaxis is a type 1 hypersensitivity involving IgE. So this concept is really repeated throughout. Really repeated throughout, right? IgE mediated degranulation. Epinephrine, primary treatment, because it decreases further mast cell release of inflammatory mediators and counteracts. So it decreases and it also counteracts. So what does it decrease? It decreases the release of mediators, all right? And what does it counteract? B system inflammatory effects. Mediators, counteracts. This first part, all the way to the degranulation, is it familiar?
Yes.
Because it has been addressed before and before, right? So you kind of see that this concept of IgE and degranulation is being repeated. So you get encouraged to tackle this part. And then what happens is that you come to see the release of chemical mediators and the IgE receptor mediation on degranulation. This gets reinforced and reinforced, and that's why I've been telling you that you should solve questions in aggregation. So please do not go into random question generating. Okay, so these tables are really good in reinforcing the concepts. And now we kind of see that there are these concepts suggested to you that there's a immune-mediated and non-immune mediated, and then you see now the insects thing. Oh, so that's why the question 2 sounds like wasps. This kind of suggested anaphylaxis, and you further know that this was the immune-mediated type. Kind of building up and up, right? And then clinical manifestation, what do we have? Cardiovascular, respiratory, venous, and gastrointestinal. And what do you want to see in this table, in this much of information that you can relate to from the previous question solving? What is really highlighting vasodilation, right? This was actually the core concept of this question, right? And then upper airway edema. This was actually the core concept of this, right? The upper airway edema. So you see now that these information that this person has anaphylaxis, right? And then the FD is started. So in addition to its effect on airway and circulation, blah, 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 right? It's going in the reverse direction, if you can notice. So the question part was addressed very later on. And the reason is clear. If you go to the questions directly, you have to read all this part without knowing how much you know of it. But if you kind of see the scheme, the chief complaint, what's going to be asked of us, and then this is about anaphylaxis, and then the educational objective suggests that epinephrine has this much of an effect, then you come to know that this is not much I should be focusing on. The real focus is that decreases mediator release. Alright? I can specify it a bit further. Effect on airway and circulation. This part, where is this suggested? Where is this presented in the solution? It's this part, right? Counteract systemic inflammatory effects, so shock and non-constriction. So its effect on the airway circulation is going to be counteracted. What's the following mechanism to mediate the release, which is presented on this part, decreases the release of inflammatory mediators. So there's a corresponding part to each of them, and this is the part where one should be very aptly doing. You should not be reading off of lightheadedness, kind of feels important. Merely think that kind of looks important. No prior medical conditions, so this also looks important, right? And you can actually go on and on and on, but actually this part altogether is just suggesting to you that this person has anaphylaxis. Okay? This is the crux. You should not be wasting your effort, your time, and your attention on something that is very exhaustive, but more so, be able to focus on what the chief complaint is, what the educational objective was, the recurring theme, IgA mediation and degranulation, and the new information that was presented. Epi firstly decreases, and secondly counteracts, and the counteracting part was in the airway and circulation. So what's the decreasing part, right? The decreasing part, the inflammatory mediator. So inflammatory mediator release. Done. And then you see later on why. It's almost like in their third round of their study. You see later on that why so many people fell into this blockade of tissue histamine receptor. 26% went into this. Why did they choose this, right? It's almost in their third round of study that you can address this part. And then if you do address them, you get the question mark. So let's move on. H1 antagonists block tissue histamine receptors, preventing their effect. However, they cannot release the mast cell release. Just too much, right? H1 antagonist, this is a new concept, right? So far, this is a new concept. H1 antagonist block histamine tissue receptors. Also, the blockade of tissue histamine receptor was actually referring to the H1 blockers, not the adrenaline. Not the adrenaline. Was this critical in getting this question right? No, right? So it may have been critical if you were, going through all the choices from the first, but this was actually not required of us to get this question right. And if you start to try on these information from the first, then you get exhausted. That's why I did not suggest going through all the choices, going through all the information. Focus on what was minimally requested of us, okay? And you actually have one more to add to this, is that if somebody has a pruritic rash, this points to anaphylaxis. So far, even though we have not studied anaphylaxis generally, we collected a lot of information about anaphylaxis and its clinical manifestation. There's the vasodilation, there's the upper airway edema, there was the hyperinflation, there is now the urticarial rash and pruritus, right? So step by step, you're kind of gathering up all these minimalistic information. Also anaphylaxis. So what do you do? Chief complaint, right? 52-year-old woman. Pain and redness. Affecting her left leg. On examination, there's a diffuse erythematous rash, which of the following is elevated, and this is zero. Following is elevated. Zero acid and the result of a medication reaction. Also, the patient had a cheek complaint, and then something happened, presumably a medication, and then it caused a reaction. And the question is asking us, what is elevated as a result of our medical reaction? So just by these two lines, you kind of dissected the question itself. And you know that it's going to be anaphylaxis, right? And the educational objective suggests to you that anaphylaxis is the result of a widespread degranulation, free-form inflammatory mediators. I think this is reinforced a lot of times and should be familiar by now. And it suggests to you that histamine tryptase and tryptase is relatively specific. So it can be used as a marker. Where was this suggested? You kind of know right now that even without reading the rest of the part, there was something about this that was suggested here, right? It's the tryptase part, right? Which was not addressed in this part. So actually the correct sequence was that in their first lapse of study, they get this question right, tryptase. And then going back, you can address this information with ease. Is this okay? So this is why I was not eager to read all the information presented in this part, because it is presented to you in a similar manner here. So you see this change of sequence, right? What's the benefit of learning this tryptase thing here as opposed to learning it here? What's the difference? They're both in the same concept, right? if we are to address this information, help confirm the diagnosis, tryptase, in this part is really heavy because you have a lot of other things that's getting in the way, you know. So cerebral edema, laryngeal edema, hyperinflated lungs, anaphylaxis, respiratory compromise, respiratory shock. That's the main concept here, and then if you try to put this on top of it, it's really heavy. All right. So you kind of see now that this much is going to suggest that how the medication resulted in anaphylaxis, right? So let's read through it. It's going to tell us a lot. And I'll be presenting the minimalistic approach of processing this information. So patient symptom began, blah, 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 and then she cannot walk, then it's large, erythematous area, and clearly tender. She was admitted for, so it was a cellulitis. So this much is kind of useless. So the woman came with a cellulitis, right? And it started on intravenous vasoline. Several minutes after, she experiences blah, 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 and blood pressures. It's very low, and then very low, and then there's a skin rash, and also wheezing. So let me ask you, this much, was this critical? This much. What is this trying to tell us? That the person is experiencing anaphylaxis, right? So this much is saying to us that person is suffering anaphylaxis. So actually, from this point on, this was not important in terms of getting this question right. The woman has cellulitis, and it started on intravenous baseline, so she started on medication. Even the cellulitis part is not important. So the woman came, and then she was treated, and then mom was fasting, and the rash, pruritus, and the flushing. A rash, pruritus, flushing, and nausea, vomiting, and abdominal pain. So this much is the clinical manifestation, and we see that there is indeed shortness of breath, bronchospasm, right? Spasm, shortness, right? Diffuse itching, some cutaneous part, dizziness. I don't know about that. Let's move on. This is the very good response. Let's move on. BP is low, and the heart rate is tachycardic. And there's a skin rash and wheezing. Also, bronchospasm. Permeability, the hypotension, and they also have this pruritic part, which is all shown here, right? This is all shown here. So I'm trying to suggest to you that these concepts are reinforced. And that's why you should be very selective in reading what is requested here. Okay? Is this all right? Does anyone have any comment before I move on?
Well, I have a question that you mentioned about the 4 rounds. And then if just skimming through the question, the explanation is if there's the first round, what would you do in the second and third round? And when should the second round has to be done? You mentioned of the first round. Does first round include entire questions from the USMLE? So basically we have 3,000 questions. Does it has to be separate. The first round has to be separated by as the subject, like for example, the cardiovascular, urology, and so on, or the first round has to be done with all the rounds of the 3,000 questions.
So I think that's a very good question. So when does the second round commence? Is it after all the questions have been addressed, or is it system by system? And I actually think that it should be kind of in the middle, because if it's the reason why I'm saying this is that people are quite different in terms of how much they know and have studied. So, for example, the clinical manifestation of a anaphylaxis reaction may be very familiar to somebody, and yet for others, it can be very, very unfamiliar. And if somebody thinks that, such cardiovascular, respiratory, cutaneous, gastrointestinal manifestations are unfamiliar, and that's why I was not able to catch on that from this part the patient was having an anaphylactic reaction. If they were not able to do that, then it is worthwhile to go from the top. If they've done the question 19, it's worthwhile to go from the top and reinforce this concept again. So yeah, if they feel that they have not attained the familiarizing part, then feel free to go from the top and do it again.
So what was that?
My method.
Yes. Did you finish 3,000 questions all at once and then go start the second round?
For me, a lot of the information here were very familiar because I have been dedicating a lot in my curricular studies. But so the familiarizing part was relatively short. But hopefully, a lot of this should be familiar. Because you have studied diligently throughout the curricular studies. Okay, so days. What was requested? Somebody was started on antibiotic, and not antibiotic. Somebody was started on medication, and then went through this much of clinical manifestation. And the question is asking what is elevated as a result of this reaction. You should be able to know that this was the clinical manifestation of anaphylaxis, which is shown here. And then you were able to add on that tryptase is a relative specific material molecule to the anaphylactic reaction and can be used as a marker. And hopefully, if you have retained this information, then at your second or third round, when you really get to read on, you should be able to accept this information with ease. So, I think this tryptase relates to kind of foreign design here. I'm going to review anaphylaxis and read the Forward and Beyond videos and lecture notes. It's going to take an hour just doing one question, and presumably without the reinforcing recurring themes. First aid is good. First aid is very, very, should I put it, high yield. But without specific indication, I suggest that you stick to dissecting the questions themselves. So only with specific indication that first aid is of use. And first aid is good because it gives you a scheme. Okay? What I mean by that is that you learn about anaphylaxis, right? You learn about anaphylaxis, but what concept encompasses focused on the anaphylaxis itself. And then I gathered the recurrent cases, and I'm quite confident on seeding out the necessary details. So if you're not able to do that, that is to say, you lack concept, you lack general knowledge. This is too much. This selective reading is too much because this concept is so unfamiliar. Then you go to the first aid, and hopefully with the knowledge, general medicine knowledge. But we have, and it is our task to study generally and diligently. I'm only mentioning this methodology to aid in a sustainable way of tackling these questions. So if there is an indication, feel free to refer to the first aid. If not, focus on the questions. So I'm really tempted to go into this question, but President insists that I tell you about the registration part. I actually would like to come down on that because it's all in it tonight. So, registration.
And we will make a screenshot, each screenshot with the explanation. So if you can just follow the screenshot, it will be all good to go. Thank you.
Well, the registration itself is kind of burdensome, I must admit, but it's all in the internet actually. And I don't think there are many who have problem with it. So we already have our institution certified by the ECFMG, so the individual does not need to present the certification. All right, so the 8-year-old girl brought onto the emergency appears to not feeling well. One of these questions that's really difficult. This is actually a typical question that one has to know purely from the clinical manifestation. Most responsible for the current condition. What do you think about this? What's going to be presented until here? And physical, right? History and physical. So we have banked up a lot of information about anaphylaxis up to this part. And here, the question is asking from on, can you tell us, just from the history and physical, that this is anaphylaxis, right? So the educational objective. Anaphylaxis is the IgE-mediated allergen result of histamine release. Histamine causes widespread physiological effects. So it's the histamine that causes physiological effects, including vasodilation and irritability and cataphory and bronchocompression. So this much is given to us here. This much is given to us is respiratory, cardiovascular, GI, and neurologic. And it is in this question that we can dedicate more upon the symptomatology of anaphylaxis. So you know how here I did not spend too much upon the specific symptomatologies, because so what was actually requested of us is that, so if you know that this is an anaphylaxis, you know that in the lab the tryptase is going to be elevated, right? But here asking front on, do you know the symptomatology, right? That's why we are able to dedicate more of our attention on the clinical feature of anaphylaxis, the symptomatological manifestation of anaphylaxis. So let's see. So ocular, oral, mucosal, and skin. There's going to be those parts, upper airway, lower airway, and then vasodilation and cardiac. And there's going to be cardiac dysfunction. Vomiting, abdominal pain, diarrhea, headache, and so on. Okay, so there are a lot of information. Why did I take time to dedicate on the details? Because this question is all about the symptomatology, right? It's all about if you know that this is an anaphylaxis purely from the history and physical. That's why I took the time of reading it head on. And so mediation, degranulation, release of histamine. This was mentioned so much, and although multiple chemical mediators play a role, histamine is believed to cause the most significant broad range of effects. So it's all about histamine, I guess. And the receptors are going to have a role. In addition, we activate peripheral nociceptors. Is this selective reading too much requested? Up to this part, I'm asking. You orient yourselves on locating the information. And then you read it on. So, patient was at a picnic, nausea and vomiting, abdominal cramps, and diarrhea. So you see that the gastrointestinal tract has this part. That is checked. Alright. Reports feeling dizzy. So headache, confusion, blah blah blah. Lightheadedness. Here it is. And then the BP is low. Tachycardic. And then there's iris character rate. It's kind of pointing to dyspnea, but not necessary. Pale and listless. Is there pale and listless here? Not much, but not much. Let's move on. And I have a reason. All about the reason part. Is the airway part, right? Wheels are present. Here's the wheel. It's actually another term for paradigm. Kind of, it's not much tangible, is it? You read this, and if I did not tell you that this is an anaphylaxis, would you be able to know that this is an anaphylactic reaction? Kind of vague, right? But unfortunately, this was requested of us, and that's why you should be saying that although it is vague, I should have been able to, based on the symptomatology itself, to say that this is an anaphylaxis. So the But even without this, this is going to say a lot about symptomatologies here, and you have to go backwards. So if somebody has anaphylaxis, there are going to be GI symptoms, nausea, vomiting, abdominal cramps, diarrhea. They're going to have neurological. I think it's more cardiological phenomenon, like headaches. They're going to have hypertension, tachycardia, phase dilation, tachycardia. They're going to have wheezing, so respiratory, upper airway. I think it's more of a lower airway. That's the reason. And they're going to have wheals, which is the venous skin or urticaria. So, okay, I familiarize that, and then let's move on. This is how it goes. So please do not be so obsessive about getting everything in one round, in their first round. Here, 24%, so it's about half of people went into this mast cell-derived histamine, which was a concept that was already so much mentioned in the anaphylaxis part. About the other half, other 50%, half of the people who got wrong went into this gram-positive bacterial exotoxin. What's the deal with this? So, if I want to get this question right, I should be able to know why choice B is wrong, right? Why am I not obsessed about assessing the choice B? Does anyone know what this means, gram-positive bacterial exotoxin? What is it indicating? Not much people know, right? Is it of interest? Of course it is. It's necessary to not get this question wrong, right? But is it of interest now? No, it's not. And that's why I keep on telling you, please do not be too exhausted in your study. Move on, and this part will be picked up later in your study. Okay? So this is actually the Staph aureus toxin, exotoxin. And many people fell for it because of the water diarrhea. There are specifically reasons why this is not it because of the other symptomatologies. Not of concern in the first class. The first class, familiarize yourself with the clinical symptomatologies of the anaphylaxis, which was requested of us here and no further. I think I've kind of delivered all what I have to say. It's almost repetitive from this point on. May I ask if one has any questions or remarks or the main objective of my talk is that somebody try this minimalistic step-by-step approach and then be able to pick up from that point on because it's going to optimize into each and every one of you. But starting heavy, starting exhausted from the first step, that was the trial and error that I mentioned. So many people fell for, and that kind of led them to abandon their attempt at step one. So please, if somebody has any comment on my methodology, on my approach, please feel free. And I think that's pretty much what I wanted to say. Thank you.
All right. Thank you very much. Appreciate it. Okay, guys, just to give you the summarizations, I also So basically, USMLE also included in this yearbook platform. So if you are interested in preparing the USMLE, you can use this platform. Yes, someone had mentioned about the first aid. It's a great tool, but you don't want to waste your time searching which material that you have to study. Same thing that also applies for the oral exams. When you guys study oral exam, you guys probably wasted like 1 or 2 weeks to search which material is good. Same thing, USMLE, USMLE, or AMC, you don't waste your time on searching which material is good. UWord is best, it's the best tool, explanation is more than enough. And as he said, first, second, third, fourth. Why did he divide this round? It's because of the active recall. You can't remember all the information at one time. You have to repeat what you have studied every time, and the 4 is the minimum number that you have to review. So in the first review, just skim through. Just skim through what kind of questions the USMLE is going to ask. What kind of the high-level questions that I have to know. Because let's say this entire black box is a medicine. You don't know what's high-level. So you don't know what USMLE is going to ask. Why you shouldn't study from the first aid is because first aid is not going to teach you what kind of questions the USMLE is going to ask. Right? So what you have to know is study the practice questions because this is the questions that actually came out from the USMLE. So this is basically the centrifugated questions that you want to skim through first. That's the first stop. And the second stop is that you dissect each explanation that has written on it. The study shouldn't be stressful. Why? What's the purpose of studying USMLE? What is your purpose? To become a good doctor? Do you really think so? Well, what's the purpose of doing the USMLE? To get a pass. That's your purpose. You need to get a pass. What's the pass range? 60%, right? So you only need to get 60%, not 100%, not above like 200%. You don't need that. You only need to pass 60%, right? So you don't want to know the entire stuff that is written in the clinical features and anaphylaxis. You don't need to memorize all of it. You will eventually forget. Is there anyone who knows deuterium? Deuterium. It's a suture that you find in the skull. It's basically the suture that connects it's a middle point of the frontal bone and the parietal bone and the sphenoid area. It's basically when you get the trauma that this area is the area that is most vulnerable for the trauma. Do you remember this? No. But you get to know this when you solve the questions. You know what's highlighted now. So basically, reading through from the first aid, yes, it will help you to gain knowledge. But gain knowledge doesn't mean that it will guarantee you for the passing mark. Passing mark, you should study from the practice questions. And this technique is necessary, not only for the USMLE, but other kind of, even doesn't have to be medical related exams, like bar exam and so on. So if you know this technique, and if you can apply to your studies for future licensing exam, this will be your cornerstone on preparing any kind of exams. That's why I invited Ki-Chang, because I really found this very useful in the technique, because you don't do this in Hungary. You basically start from scratch. But in USMLE, the licensing exam, the technique and the methodology has to be approached differently. That's why I wanted to throw and invite Ki-Chang to let you guys know about this information. And I will, this live will be on my channel. So when you get onto the train where you want to prepare your license exam, please report to the past video that I have uploaded to the channel. So I hope this session was useful, not now, but in the future. Thank you very much, guys. Appreciate it.
This is immunology, anaphylaxis. That's why I like it. But in the spray shot, we just have the entire yes. Sorry? Yes. It will see. You can design. I also the yellow very big time. You can actually do a highlight. So in fact, I recommend practice with yellow highlighter instead of using it highlight gray color. You understand? So this thing that you see over here is basically what we will see in the USMLE. The USMLE will also have the left back as well. What? Oh, they have all the left back. So you don't have to memorize. It's good that you keep know, but they will have the left back. So yes, and the same form. It's very similar. You will have. Preparing right now. But I'm doing chemistry at the same time. The same technique. I mean, like every kind of the exam will be like you have to approach like this. It's most of the time. I mean, like USMLE, for example, UK also has. So this template is called USMLE, right? It's a company. They also provide USMLE.
Oh, so that's another thing that you have to purchase.
Yeah, other things. And the USMLE is much cheaper. USMLE, from my experience, compared to the USMLE, it's the hardest. Yeah, why? Because USMLE, if you read a sentence and so on, you directly go to so the question asks, what is the diagnosis? But this one sometimes asks, if you don't know the disease, the question sometimes asks what the mechanism is. Questions ask about what enzyme is in part. Yeah, because if you don't know the actual diagnosis, you will get wrong. So it comes step two or three more steps further into the question. And there are many traps in the questions. There are many questions that you need to exclude, that you don't want to read. That's why he's saying the patient's information and the reason for the admissions go at the very bottom to read of what is this question.
제가 응할게요.
That's the technique. Yes, that's the technique that you can understand.
So because this is is there any amount of times you can do this exercise? Like in one
You don't
sitting?
want to do
More than once?
no, because they will see the report. How many times you have tried. And if you have records that you failed, it's not good for you. It's not good for you. Basically, it's going to be super hard for you to get a place in the United States. So take as much as the time. Now, what year are you? Start from before here. It's okay. Now, just focus on your studies until finishing the third year, and then start studying the USMLE in your fourth year. That's what I would do.
And are there any exam patients
In what?
I can suggest most of all go to Budapest to do this.
Yeah, I wanted to hold this because my term will be next year, graduating. So I wanted to show the technique rather than like talk register. But I will share that one as well. But like this technique is a subject technique that we never have. Sometimes we can think that's not stuff. That's just like it's a yeah, it's like a shortcut, you know. And you need to control why? Because the preparation time for the USMLE should be less than the first round. And if you start from the first day, from the textbook, it will take forever. That's why you need to focus.
If you refer to
If you are step 3, but if you finish step 1, basically step 2 will only take 3 or 4 months. So step 1 is the most important. Step 2 is hard as well, but step 1 is the hardest. You don't know the concept.
And for the other, you mentioned, I think some other.
Family and so on. The concept is the same. You divide it into 4 stages, right? First is skim through, dissecting the understanding the questions. What kind of the questions that Family wants to ask? That's the first part you want to do. Second part is you basically try to memorize what is written in the exposition. The third part is you try to solve the questions. The fourth part, you try to analyze altogether why this is not an answer. You branch out the knowledge. You know what I'm saying?
How much is this exam? This thing and exam, how much is the
In total, like $2,000.
like including this?
Yeah.
Okay. So
Around. I need to ask. I really didn't see the price. If you want to dissect something, to take something, money should have been there. You know what I'm saying? I think it's less than $2,000. I read around $2,000. The subscription costs about $600. If you do, I forgot, but it's less than should be around that.
and this is lifetime subscription?
No, that 1 year is 1 year. I think 1 year is like 6 months. But don't do I had to explain you really don't get to have the time to come to the fifth grade. Because you think you get the school get easy when you survive third year, right? But it's actually only applies for the fourth year. But if you come to the fifth and sixth year, the life goes hectic. A lot of worries that you prepare. But it's not that severe compared to the first and second grade. But you still have to prepare for it. So it's really hard to make a balance between the best time for the second.
What happens if you study after 6?
It's okay, but like the hospital will ask you what have you done for during this gap year.
And then you can say that you've been preparing for
That's not enough. That's not enough. Because you know why? Because USMLE, one, the United States, in order to work in hospital, you need to pass the USMLE. So which means the US, they have 4 years. Right? So they usually take the exam, USMLE 1, their second. And then when they graduate, they take USMLE. And then they go. Right? So they do this during their school. What about us? If you do this after the medical school, it's not a good point. It's only going to make you, not a negative, but you need to do something other than that.
And what is this matching? Is it based on the score? Based on the score, you get this particular student, or is it you get what you want?
That's most probably right, but you also have to have a good recognition, good CV, good motivation letter. This also have counts in very stuff. But I'm still working on it. But my main focus is passing USMLE and you can. That's it. And the future stuff, I can think about it later.
How about it for
MLE, it's easier to listen. So I started MLE first, and I thought it was really hard. But then as soon as I experienced USMLE, I found MLE is less. So I'm kind of happy. Yeah. And then USMLE kind of helped me prepare MLE because as a international medical student, I need to take the pre-exam, pre-MLE, which is harder than MLE, because they want to filter out students, so that's why they need the pre-exam. The pre-exam is usually very hard. And usually they ask the stuff that you really will ask if you can't play. I can just get them on. And the stuff that you most likely forgot in your first and second. USMLE actually go through everything that was had run. You know what I'm saying? The third one that was mentioned during the explanation, I actually solved it yesterday. That's the information that I got in the yesterday question. And it comes into my mind. Why? Because rather than if you read, you don't know what's important. So you try to memorize everything, and that's going to work, and you will eventually forget. But if you do problem solving technique like this, you know what is higher. Because this question actually asks about the therapy. So I know this is called technique. The technique of solving the questions, the going to the explanations, that's going to help you more efficient way to know the knowledge. But I really don't recommend this in studying the oral exam because that's like a different story.
So, like, if I buy the subscription, how will it be of any use? Like, because as I said, we can select whatever we want.
Yes.
So, if I do that for the subjects as now, would that be
Yes, but no. Because school requires to know more. Yeah.
Like, because I was thinking, like, maybe you can start early.
It's gonna just make you fail. Just what you do, study more than the other. Because when you study, if you're a second year, the biochemistry, for example.
No, I'm just.
Okay, well, like for example, like you're saying biochemistry, right? Then study the other disciplines like more than beyond, sketch, and so on. Sketch, like because the sketch usually start from third year. It's microbiology. Help you to make memories.
So that's a website or like is it videos?
It's a videos and so on. It's a free resource. I think Cyforce has free resources. But like finish the other resource, or when you come to the period that you start studying the USMLE, that's where you want to only focus on the one, not the other. You know what I'm saying?
So in the beginning, just finish all that most.
Yeah, all the other resources.
During the curriculum?
Yeah, during the curriculum. Focus on your curriculum, because without finishing the curriculum, you won't be able to understand all the things. This is the reason why we would do the first step, skim through section. Basically, I usually spend 5 to 10 minutes per questions to understand and to dissect the questions, right? But without finishing the curriculum as a medical student, it will take forever. You know what I'm saying? Thank you guys.
아니야, 아니야. 좋았어. 아니야. 그렇지. 좋았어.
약간 리허설을 하고 왔거든요.
진짜?
그래서 이제 영어를 해야 되니까 그때도 영어가
아니야, 아니야. 잘했어. 이거는 어떤 소재를 하는 게 중요한 게 아니라 너가 어떻게 공부를 했고 네가 6월 되면 어떤 식으로 공부를 해야 하는가 거기에 포커스가 맞춰지는 거라서 네가 프레젠을 얼마나 맛깔나게 잡아내는 게 중요한 게 아니야. 자, 그래서 나중에 나중에 질문해 줄 수 있어. 그리고 저거 지원했었던 거 있잖아.
그거를요.
내가 만든 거.
그거를 사실 강의한테 시키려고 했거든요. 저는 그게 너무 오래 걸렸어가지고
내가 진짜 잘하는 거.
관련된 건 뭐 시간 드려보겠습니다.
고맙습니다.
몸이 좋은 데 좋은데 이게 또
이거는 괜찮아. 지금 당장 돈이 내려가는 게 아니라 나중에 애들이 부시를 볼 때 그때 쓰라고 한 거고 사실은 지금 요 라이브 찍는 게 더 도움 많이 될 거다. 수고 많으셨습니다. 수고하고 내일 봅시다. 내일이 아니구나. 다음에 뵙자. 수고. Alright guys, we're done. We're done. Let's see. 뭐야? All right, guys. I hope you guys have found useful about this session. I have to turn off the streaming because I have to. I want to make this live posted in my channel. So I'm going to close the session and I will start the study streaming around as soon as I get back to my home. So I will see you guys later. Bye bye. Thank you. Appreciate it. Bye bye.